See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
I'm Shauna Butler, the host of See You Now. Healthcare visits have had a familiar, comfortable, and somewhat predictable routine and rhythm that many of us have experienced and that we've seen played out regularly in our favorite TV shows and films. You arrive at a clinic for your visit, check in at the registration desk, complete some forms, take a seat in the reception area along with others waiting for their appointments, and prepare to be seen. It all seems pretty simple and straightforward. What isn't visible is everything humming along in the background to ensure safety, effectiveness, efficiency, privacy and comfort, and compassion. And what becomes almost imperceivable are the entire set of design choices and decisions in this whole process. Everything in the arrival to departure experience is intentionally designed. There is a thoughtful science, practice, craft, and art that is part of every touch point, transition, and script in designing that journey and experience. COVID-19 has changed the way we do almost everything. Actually, no, it's changed everything. Not only in our healthcare settings, but at grocery stores, gas stations, schools, hair salons, restaurants, courtrooms, hotel rooms, airports. Now more than ever, we need designers who are steeped in public health to help us reimagine returning to social life in the era of COVID-19. That's why nurses, who are also designers, are invaluable. In this episode of See You Now, we meet nurse and designer Brittany Merkle, the first and only nurse at UH Ventures team of University Hospitals in Cleveland, Ohio, as lead innovation strategist. 3 months into the job, COVID-19 forced her and the entire UH Ventures team, along with millions of others, to work remotely. In addition to changing how and where she worked, this global pandemic also meant that the focus of Brittany's job as a designer and innovator shifted as well. We talk with Brittany about innovating and disrupting in a crisis.
When things are stable, as pre-COVID days, I would say roughly fairly stable, innovation is looked at to jigger it up, to destabilize, to detach from the ordinary. And ironically, when things are in chaos, innovation is looked to more for the insights, the solutions, and to turn the rain into silver. And we're playing the counter role in a lot of circumstances to our usual disruptor role within our health system.
And she tells us about the process of building a playbook for a safe and healthy return to our daily rituals and routines at school and at work and play.
And I walked the halls of schools I've never been in before, and I found myself peering into the school nurse's office, contemplating how much this role will change, how much this space will change, and the relationship of return to school on return to work. Every organization now is a public health organization in some sense. So with reactivation and recovery being keywords in everyone's inboxes, we started to think through how we can help other organizations and community members that are struggling with reopening their doors.
For See You Now, I'm Shauna Butler. Stay with us. Brittany, how do you introduce yourself and help people to understand the different roles that you play?
I've gone through many processes of building out this intro, and it's changed several times since I've started with the Ventures team. But really, it's come to a realization that I am a 100% nurse and a 100% service designer as lead innovation strategist. What I do is I streamline consumer and provider insights and amplify service design tools and design thinking methodology by partnering with clinical staff, nurses, providers, and administrators. And similar to nursing, where we take a thorough history and assessment to identify gaps, our process identifies systemic gaps and ties in the right solution to the right problem.
You are 100% nurse, 100% designer. What about your nursing experience? You've spent some time in parts outside of the U.S., and I have a feeling that that's probably given you a lot of food for thought about what healthcare can be, is. Can you talk a little bit about some of the things that you've experienced during your nursing career that's really helped you to develop your identity and your work as a nurse?
Yeah, I'm thinking back even when I was in nursing school, the summer before my last year of nursing school. I traveled to Akwata, Ghana, which is a village in Ghana on the coast, a seaside village. And I left with an IRB approved study. I had this framing of what research was in my mind, that I could do qualitative or quantitative, and I developed the survey and got it approved through IRB. I'd gone through what I felt like were all the right steps, and had also joined a group which was called Work the World for this midwifery internship, and really fused the two together. And when I got there, I realized that my biggest asset, my biggest tool to use was my journal, and just listening and understanding what their stories were and how I could drive insights from those stories. And when I tried to show them the survey, they asked me first, what is research? And that was just baffling to me. I hadn't understood the full context of where I was researching, and that it wasn't this mindset of qualitative versus quantitative or a survey or interviews. It was more about really getting to the heart of what the problem is and looking at their work environments differently, from more of a fly on the wall observation technique than distributing the survey. So what I found when I got back and started to streamline these insights and all the photos and sketches in my journal and the writings that I did by flashlight, found that was so powerful. And that started to make me start to reframe how I viewed not only research, but nursing, and what I could do with nursing. And I really wanted to be more creative. I wrote in my journal that I wanted to do two things with my career, and that was to make a difference and to be creative. And now I really, truly feel like I'm doing that. I'm creating the difference. And that trip was that pivotal moment for me to start carrying into, as I started to practice as a nurse, this idea that I could shake things up for myself, that I could push myself out of my comfort zone, that it wasn't just being outside of the box, that the box doesn't exist, that there weren't any walls. And as I ventured into an inpatient unit, I started as a registered nurse on the floor that focused on burn, trauma, and neurosurgery, worked nights, 12-hour shifts, and lived about an hour away from the hospital, so traveled back and forth. And I still remember driving home from those shifts and hearing the call bells ringing in my ears and thinking about the patient stories and that connection that I made with patients that really made nursing so powerful to me.
So the 100% designer, how did that happen?
As I ventured into other environments and eventually found my way to hospice case management, where the service delivery had so many gaps that I wanted to fill and wasn't sure quite how. I wanted to bring that creative element and that contextual research element, and found my way to design school. But again, I felt like I had to break out of the box. I felt like I had to jump on a plane and get somewhere farther to really think about this new, it seemed like two different worlds to me for some reason, art or science, and I had to choose. And design, I found, is really right in that middle. When I went to Savannah College of Art and Design, it was not healthcare focused. And we did a lot of case studies and projects on other industries. And that forced me to think differently and push beyond the walls of the healthcare experiences that I had and really look at it from more of a consumer lens. But trying to then translate that into a healthcare system has its challenges, in that there's limited resources, there's a lot of complexity, there's politics involved. And so I think to learn those best practices from a consumerism type of world and then try to translate comes with challenges, but there's a lot of opportunities as well to not only bring the clinical lens, but also the service design tools that I've learned in school and fuse those together.
So service design, can you describe that a little bit more?
Service design is a broad, all-encompassing approach to looking at various parts of the service sector and understanding how to drive insights from contextual research and conversations and various methodologies to then translate into maps and visualizations and mock-ups and anything that can really speak to what the gaps might be, and then start to fill those gaps. And all along the way, this is done alongside of whoever is that end beneficiary and anyone that it might involve or impact. So rather than designing for, it's designing with.
You had just been working with the ventures team for a very short period of time, probably working on the typical type of challenges that health systems encounter when COVID descended upon us. You were pretty new on the team at that point, right?
Yeah, and our team normally works within the heart of our main campus, Cleveland Medical Center. And as expected, with the risk of exposure at a high traffic area, we're now primarily working remotely. But yeah, it's definitely been a shift.
And COVID-19 has really set off a wildfire of innovation. How did things shift for you in the terms of projects? And what I'm thinking about is, how did you source what projects, what things needed to be solved? How were those presented to you? And then your team is working virtually. How are you solving them? Because this has really changed our timelines for developing a solution to a problem that has emerged and is urgent, must be solved, immediately.
Yeah, that's the thing that's been different is the pace, I think. When things are stable, as pre-COVID days, I would say roughly fairly stable, innovation is looked at to jigger it up, to destabilize, to detach from the ordinary. And ironically, when things are in chaos, innovation is looked to more for the insights, the solutions, and to turn the rain into silver. And we're playing the counter role in a lot of circumstances to our usual disruptor role within our health system. And we've had to emphasize the power of pause. And as nurses, we know you never give a medication without reviewing the 5 rights. And in design and innovation, you never introduce a technology or process or an experience solution that hasn't been fully vetted and thought through. For example, a few months ago, when things really started to ramp up, a group, including myself, of nurses, ventures teammates, clinical integration physicians, institutional relations, volunteer services, and other stakeholders collaborated to create a DIY mask guide, calling for the community to provide 30,000 masks for our employees to be protected in the coming months. And it was iteration after iteration and conversation after conversation where we spoke about the nuances of the challenges and the logistics to design a final product, a shared how-to guide with the community, outsource materials for kits, create the kits, distribute the kits, have pickup locations in strategic places where community members can easily access. And all of this happened within a few weeks' time frame. And we've now collected over 100,000 masks, far exceeding our original goal. But this exemplified the power of scale and design, where one document can transform into 100,000 masks, 100,000 people better protected and feeling safer. And this was also a moment where I began to fully show both that nursing and that human-centered design had at the same time. And this is carried into more PPE-related design projects around comfort, adherence, and the ability to protect our workforce moving forward.
We've certainly seen an enormous amount of attention and a need around cloth face coverings. The need for this was originating in our clinical environment, but now it's spread into citizen use. And what did you learn from transitioning from this is mostly in the clinical realm to now it's out in the community settings?
Every organization now is a public health organization in some sense. We've now pivoted to think about protecting not only our workforce, but the community at large, and thinking about every organization, business, institution now as a healthcare organization by sheer fact of being open and reactivating. So with reactivation and recovery being keywords in everyone's inboxes, we started to think through how we can help other organizations and community members that are struggling with reopening their doors, how to implement rapidly changing policies as we have to keep employees, consumers, or patients or visitors and the community safe.
Everybody is looking to get back to activity, whether it's returning to school, returning to work, returning to play, social interaction, concerts. You guys have been thinking a lot about what we need to do to safely bring people back together into these different environments. Can you say more about how the Healthy Restart Playbook got underway?
We first created the Healthy Restart Playbook by doing secondary and primary research to equip organizations with this clinical perspective on reactivation and recovery for businesses. And there's so many sources out there, from government institutions to healthcare organizations to other businesses that are providing great resources, but there's just so much that we wanted to really bring it to a digestible amount. And what are the takeaways that we need to know right now? And we've just released our version specific to schools and have pivoted to schools, in that we've recognized that without schools being reopened, a large majority of the workforce will be impacted by children staying home and in virtual classes versus the traditional in-person. So similar to what we've done in our health system, we've had to change our rituals. And with the emotional heaviness that these changes bring, it's now even more important to see these processes as experiences and workflows as journeys, and bring to light the emotional aspect of returning to a new normal. And in the school playbook initiative, we've tackled it like every other opportunity with a human-centered design approach. And we found that you can't get the real truth until you're out there seeing it, experiencing it, and speaking with those who day in and day out do this and know this context like the back of their hand. And I walked the halls of schools I've never been in before, and I found myself peering into the school nurse's office, contemplating how much this role will change, how much this space will change, and the relationship of return to school on return to work. And through inquiry and digging questions and contextual observation, we found insights along the student, teacher, and administrative journey, which form the framework for this playbook to speak to all those audiences. But it really came down to providing the healthcare voice, building the student, parent, and teacher trust, and ultimately about understanding emotion as an aspect of healthcare and of COVID-19 response.
So getting back to school is so tricky, so challenging. Can you share what are some of the things that are core to making this return to school safe so that we feel confident? What have you guys identified that are just the must-haves?
Communication is so key in communicating the changes that are happening as they're happening rapidly, and explaining thoroughly to parents as well as to students in their language and their tone what those changes might be, and being transparent in that there's best practice and then there's reality, communicating the why behind some of the things that are being implemented, of why there's screening or why there might be A and B blocks or some virtual, some in-person instruction. So it's led into now signage and other materials to be placed within schools to then further those messages.
So when you're walking the halls of the school and you're having conversations with teachers and administrators and the school nurses, what scares you? What are you worried about?
It's scary to think that we don't know all the answers yet, that we don't know what might happen, and that we're doing the best that we can as we learn and as further developments come out. I think what scares me the most is that the true value proposition of school is, it's not just the instruction, but it's the community that it provides and how to continue that community. And I think that worries me the most, is thinking about there's the content delivery and instruction that education provides, but there's also a large piece of community and social interactions that, social distancing has a strong implication on.
Yeah, because my sense is if we don't really name and address what scares us, it gets in the way of us solving it. And when I think through just the parents that I've spoken with and the questions that they have, I feel confident that we can figure this out. We have figured out really tough things before. And this is so important for us to be, to your point, be back together as community, because there's so much more learning beyond content and facts and abilities to research. Oftentimes those things can be done independently, but how we develop our social and emotional skills, that's very hard to develop independently. And we need community in order to share each other's burdens and multiply our joys and triumphs. It's hard to do without being in community. So when you've identified some of these concerns and things that scare you, how does that help you to inform how you come up with a solution?
Yeah, so a lot of insights from the environment, the conversations that then get streamlined into what is the most important information to make it digestible, and what is the right format to then deliver this information. Is it in a playbook? Is it in a website? Is it in some map form? Is it X, Y, or Z? So it's not only taking all of the insights from the visits and tours and sites and conversations, but also how can these pieces from individual schools apply to schools across the country? What are the overarching insights and recommendations?
We've had an awful lot of changes in the way we deliver service. And one of the things that the public has become very aware of is how we access care. And that model has just dramatically changed. It used to be, you needed care, you'd drive up to a hospital or you'd make an appointment to go visit any one of your healthcare providers. And we can't do that anymore. We can't safely congregate in spaces that we thought of as reception areas or registration areas. And that very quickly had to change within hospital settings. And we had changes around who could be in the hospital, how they could visit. That seems like it's right up your alley as a service designer. Let's talk about what that looked like for you, because that had to change pretty rapidly. And that's a big shift in the way care has been delivered.
So a few months ago, our chief clinical scientific officer called for ideas related to social distancing, and ideas and problems and how to address those problems. Anything from strategy to signage, and it was an open call to the system for their perspective on the issue at hand. And UH Ventures, we triaged these ideas and problems and identified patterns in those that surfaced, and coordinated with various submitters from all perspectives, from clinical and administrative, to understand the best practices and scale those. And we're having conversations across leadership and front lines where we recognized an opportunity space. And that was in this arrival portion of patients' journeys where social distancing was most challenging. For example, in the notorious waiting room. And from clinical to higher leadership, we discovered that the unmet need across various parts of the system and departments all converged to innovation and the need to redesign our patient journey under now a COVID and social distance lens. And those rituals in healthcare where we park in the lot, we enter, and we often sometimes wait to register at our front desk, and we fill out paperwork on a clipboard and potentially be cramped in a tight waiting room where even pre-COVID days, no patient or visitor truly describes that as part of an ideal experience. The rituals we have become habituated to as an industry can no longer hold true. We used service blueprinting to the earlier point of mapping. So we mapped the current state of a patient journey holistically in specific departments in urology as well as in OB and GYN outpatient clinics, and narrowed into the patient arrival experience portion of the journey where social distancing was just nearly impossible. And we developed several iterations of service blueprints, example scripting for patient education, and implemented with clinical partners a new check-in process, which came down to a process change at first, which is 2 phone calls. And the first is a call outbound to educate the patient on the change, to call when they arrive in their car and to wait in their car, and 2, to call when they arrive in the parking lot and are instructed to come in. And that thereby reduces the traffic in the waiting areas and allows patients to wait in the comfort of their car. And this came about from a collaboration across several parts of the system to also tangentially run a technology work stream, knowing that the use case warrants real-time updates and foreseeing this burden of calls on staff for just how many number of calls will need to be placed and received. But we didn't lead with the technology. We led with the people, and now are really stitching together digital tools and manual processes. But it's not just about the technology. Sometimes it is more about the use case and identifying the right champions and working through the problem with those that are closest to it.
At this point in time, the patient arrival experience is, to your point, I don't know that it was really a great experience pre-COVID. So this has forced you to really reimagine what that patient arrival experience looks like. Clearly, it's meeting our current guidelines or our current needs with social distancing. But what have you learned in this process that actually now the patient arrival experience is just so much better?
I think that the goal for us is less to be uniform as a system and be and focus more on unity. And right now we're trialing different technology solutions to provide those real-time updates. Ideally, rather than having the comfort of waiting in their car as it is in current state, eliminating that wait time altogether. There's an article by Stacy Chang that is nobody wants a waiting room. And I think we've known that for quite some time.
Well, Brittany, you got your hands full, girl.
I do. No wonder I'm always drinking so much coffee.
You sound like you're an army of one at this moment in time. And are you by any chance on a recruiting mission to have more nurses join design teams?
Definitely. That is an overall goal for me for sure. And we also host several programming events, such as our upcoming Nursing Research and Innovation Day, which is on August 28th, 2020. And I'm really leading that event in hopes to really show that research and innovation do not exist in silos, that you can't really have one without the other, and how nurses are already strong researchers and innovators, and just to showcase that and celebrate that.
That's great, because a lot of people don't see those two sides of nursing, and they oftentimes don't come together at the same time. So that's exciting to think about, how you're bringing the two of them together. Most of the times right now, what we're seeing is that those two sets of activities happen separately, and we don't necessarily see them combined or integrated. And the conference sounds like a really good way to get different groups of people in the same sandbox playing together and then sharing their skills. Does that sound kind of like what you've got in mind?
Absolutely, for sure. It's a chock full half-day virtual conference, which is open to all, and also going to be offering a coffee hour series monthly to start to build this network internally and build those connections and learn from rockstar nurses that I know are already out there. And I am one nurse and I'm one innovation team member. And I think that it's important to highlight that even though I have a nursing background, I can't answer all the questions.
You're right. You're one nurse, a certain degree of experiences, and maybe it doesn't speak to those who are taking care of children, those who are taking care of those with physical disabilities, those who are managing chronic illnesses. There are so many different experiences and nurses who have expertise in those conditions and populations, and we need to be out there with a great big huge Wonder Woman lasso, bringing them all in and contributing to much, much, much better experiences and better outcomes.
I would say if there were two key words in my mind when I went to design school, it was patient experience. And when I left, it was nursing innovation, which I think if you look at it from a root cause analysis standpoint, if you improve provider experiences and nursing experiences, particularly nurses who spend 23 and a half, arguably more hours out of the day with patients and with their families and understanding their stories and their needs, I think then that translates into improved patient experience. But it's really understanding the nurses' needs right now for me. And I felt like I was leaving nursing when I went to design school. And it was this huge revelation once I got there that nursing could not leave me.
It's really interesting to see how the nursing group that you've put together, all of these insights that are predominantly held within the walls and the confines of a health system, are spilling/flooding out into the community in ways that I don't think we've seen happen for quite some time. Are you seeing that? And are you as excited about it as I am?
Definitely. I mean, I've seen that right now. It seems like there's just no room to overthink, but there's plenty to create. COVID-19 just changed everything. But if there's ever a time to really leave self-doubt at the door and to feel the openness to create and to do things differently, it's now.
Nurse and service designer Brittany Merkle is the lead innovation strategist for the UH Ventures team at University Hospitals in Cleveland, Ohio, and part of the team and effort that created their Healthy Restart Playbooks, a set of downloadable resources to help reopen safely. As Brittany mentioned, University Hospitals will be hosting a virtual Nursing Research and Innovation Day coming up on August 28th. The first of its kind, half-day, and again, virtual conference is open to all, and it's an updated take on the World Health Organization's designation for 2020, acknowledging the year of the resilient nurse. You can register for the event at ventures.uhhospitals.org/NRID. Design, when done well, glides smoothly along unnoticed, yet comfortably and intuitively vibrating in our being. It's like magic. As Brittany mentions, designing for those delivering care is top of her mind and has been seeing a lot more attention as late as we deepen our understanding and appreciation of the importance of removing friction, waste, and inefficiency in our care delivery, but also in designing for joy, delight, empathy, and enchantment for the people and teams taking care of each of us. These rituals and routines of our healthcare experiences serve as our Sherpas and our signposts of familiarity, comfort, and confidence. As Brittany discovered, design sits comfortably at the intersection of art and science and offers a language and craft that integrates safety, dignity, sensitivity, and scale into innovation. We've all seen gaps in care and service failures, and we're convinced there must be a better way, but maybe weren't so sure what path to take to make a better way happen. At those times, we were acting unwittingly, perhaps, as aspiring service designers. Brittany articulated it best when she said, "There were two key words in my mind when I went to design school. It was patient experience. And when I left, it was nursing innovation." For See You Now, I'm Shauna Butler. Thanks for listening.
Johnson & Johnson has always supported nurses as essential healthcare leaders and is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. Johnson & Johnson and the American Nurses Foundation are proud to have launched the Coronavirus Response Fund for Nurses. Go to the American Nurses Foundation website to learn more, and thanks.